I felt apprehensive first about the telehealth consultation, purely because I've never been involved in one before. I have seen it done because I have lived in rural and remote areas before, but never actually been part of a telehealth conference before, so a little apprehensive I was. I usually do have to travel for medical appointments, even though I live in Caboolture, which is an outer northern suburb of Brisbane. It still doesn't have access to specialists readily, I guess, at Caboolture. So we do have to travel into the city a fair bit if we need to see specialists like paediatricians or general physicians or anything like that. The booking of the appointment for the consultation actually happened quite instantaneously when it was flagged by my GP that he wanted another opinion. The appointment was made promptly here at my local GP, and the advice to me as to all, the choice as to whether a telehealth conference where I could stay here locally and do it, or go into the city. They were made pretty much probably within a week, which was pretty good, I thought. The information that was given to me about telehealth by my GP, by the health worker, and also the other medical staff that work at my GP, explained to me what telehealth was all about. It gave me a good idea as to whether I wanted to participate in it or not. All the advantages about it, well, they're obvious. You actually can stay home and come and see a specialist. But there's always a chance that things are going to drop out or technology's not going to work, and you sort of know that going in. So my daughter's experience with telehealth today was, I think she's still not used to the fact that the doctor was on the other end of a television screen. I think kids think TV, they can't see me, but I can see them. But once she got used to the fact that Dr. Andrew could actually speak to her and she could interact, she sort of warmed up to it. She was a little bit apprehensive at first, but no different to any other consultation. She'd want me to talk for her anyway. But she does, she did actually talk to the doctor about something she noticed in terms of the lesion on her face as well. So I thought that was good. She enjoyed it, I think, at the end. The role of the health worker in the consultation that we had today, I think it's an important role, purely because nursing staff usually are taken up with other consultations in the main clinic, but it's also good to have a health worker who's from your community, knows how to, if I'm not understanding what the doctor's saying, he's there to actually back me up and back the doctor up. So it's good to have someone like him in the room, very reassuring about the way telehealth was going to work, and supportive for my child as well. Without the telehealth, the option of telehealth, I don't think that there would have been any barriers with the booking of the appointment, but actually getting to the appointment probably would have been a little bit difficult for us. I have 2 other children that I care for, a husband who's a shift worker, so it's a matter of me juggling time to be able to fit in an extra hour, 2-hour round trip to get my daughter and myself, that's 2 people out of a family of about 5, to a specialist appointment where you never know how long the consult's going to be, and then I've got to get myself all the way back and pull her out of school at that time. Having telehealth, I didn't have to do any of that today. It all just ran really smoothly, and disruption to life was actually quite minimal, so it was good. So in terms of privacy for the consultation that just occurred with the telehealth consultation, I didn't feel at all worried that anyone was going to burst in on the conversation, and the fact that we had the doctor on the screen and we were sort of talking live, that didn't really worry me too much, because I know that here in this clinic, I trust people here in the clinic, and I trust that the clinic here guards people's privacy, but they also know that when the door's shut there's a consultation on, so no one bursts in, and if they do they usually knock, so I didn't have any worries about that sort of, I guess, breach of privacy.